what I do.
With the transformation they experience by belonging to the self-help groups, members are passionate about spreading the benefits, so they reach out to sufferers outside their groups.
Basic need for Edimaye. Omudimaye free. And in Texas, woman is can see a catcher or Womoba. Omukojin Ronoa, also Mritie Bino, who am I fair.
The Mental Health Society of Ghana, MESOG, came into being recently. Made up of elected officers at a delegates conference of district associations, it gives self-help groups a stronger voice at the national level.
With this secretariat, we'll be able to initiate and implement development programs. Since we are in Accra, the seat of government, we will also be able to talk to government and departments and agencies on mental health issues.
Increasingly, they are taking control of their lives individually and collectively, and would play a very useful role in articulating their needs and concerns in the ongoing political and economic discourse that's go on nationally.
I think much of what Basic Needs is doing is helping. You're helping people with mental illness to seek treatment and then to be able to advocate for themselves. By forming the Mental Health Society of Ghana, you've created a body that is able to represent the interests and concerns of people who've had mental illness, and that's the best way to speak for these people and other people with mental illness. When they see people speaking about these issues, they recognize something in themselves and think, oh, well, this person is speaking, oh, this person is acting in the community, this person is advocating, maybe I shouldn't be so shy, I should seek help. Or if you know someone in your family that has an issue and you hear on the radio or you see someone on television speaking about mental illness, maybe you won't be so shy and think, oh, I should help my sister, I should help my brother. There are these people who can help them become better.
Community derbers of self-help groups is one of the ways MESOG gets the attention of the public and policymakers on the plight of its members.
It is one of the many ways to publicize and educate the public on mental health in Ghana, especially important issues like the rights and needs of the mentally ill.
Right now, there are 239 self-help groups across the areas that Basic Needs work in, with membership of over 10,730. And I never cease to make this analogy that imagine these 10,730 people were your constituents and are legible voters. What will a politician do?
Our government will do everything possible to improve conditions in this sector. As a government, we rate mental health high on our developmental agenda. And it is for this reason that we decided to capture the issues on mental health on our manifesto. To this end, we are intensifying all efforts to integrate mental health into public health services.
I wish to assure that myself, my regional minister, as members of parliament, will assist with the passage of the mental health bill when it comes to the parliament.
I wish to acknowledge the self-help groups, the Mental Health Society of Ghana, national and local government officials and representatives, support NGOs, field volunteers, and officers of Basic Needs. Your commitment has been recognized in the implementation of this project and by your presence today at this Durbar. Through your combined efforts, the movement towards full human rights and access to socio-economic services for persons with mental illness and epilepsy will be enhanced.
Stabilized persons are provided interest-free microloans to undertake ventures that will give them a livelihood. Some have decided to go into poultry. Others are trading with their credit facility. For some, it is preferable to have a phone card retailing and call center.
I'm working and I've been getting money to cater for myself.
This is only a microcosm of what is taking place in the Greater Accra, Northern, Upper East and Upper West regions now. Very soon, the whole country will be covered. With the strides the self-help groups are making, they are moved to extend the benefits to other sufferers, but are constrained.
And so that is not there.
There is need for government to include in policies and programs issues that relate to marginalized and excluded groups like self-help groups, because if they are ruling by the mandate of the people, they probably are those that need to be looked at, because the government is there to ensure that those who are disadvantaged and voiceless would be taken care of, because we cannot continue to be in survival of the fittest. Some people have to protect a certain vulnerable group to come up, and I think the number one duty bearer for that matter is government.
If government pays heed to this and other calls like the passage of the Mental Health Bill, it will not only be doing its duty, but helping to reintegrate the mentally ill, epileptics and other vulnerables into society. This will put them in good stead to contribute to development. Only then can we claim to have effectively utilized our human resources to the fullest for holistic development. For now, the self-help groups say they will keep on trying till something is done.